Hello, my name is Jennifer Solis, and I'll be presenting a PowerPoint presentation on a change quality management project for Nurse Leadership and Management Laboratory Class Nursing 451. The topic that I have chosen for my change quality and improvement project is to reduce the number of elevated blood pressure readings that are taken while the patient is at their primary provider's visit in an ambulatory medical clinic setting. My quality variance, according to the American Heart Association 2017, the standard quality or ideal blood pressure reading is systolic less than 120 and diastolic less than 80. The highest elevated blood pressure reading in our clinic that we had for my trial was 167 over 99. The difference or undesirable variance is a 47-point systolic and 19-point diastolic. My root cause analysis. Many patients have elevated blood pressure readings during office visits with their primary care providers. Blood pressures were performed at the beginning of their visit, prior to an evaluation with their doctor, in a noisy medical office setting, while anticipating telling their doctor their medical concerns to their provider. The root cause analysis is the anxiety some people feel when anticipating an evaluation by their doctor. There are a handful of studies that have been done investigating the effects of music on various vital signs, namely systolic blood pressure, diastolic blood pressure, and heart rate. Many of these studies have also assessed effects of music on self-reported anxiety level, attributing some degree of music-induced anxiety relief to the beneficial impact of music on vital signs. The relaxing effect of music have been culturally accepted for centuries. Despite this, music has not been given much attention in formal medical settings, where patients experience heightened levels of anxiety. While anxiety does not cause chronic hypertension, it can lead to acute elevations in blood pressure, as may be noted with patients in a variety of medical settings. Thus, blood pressure and heart rate may be a result of anxiety in these settings. This was according to Lumba, Ora, Shaw, Shardeska, and Molar, 2012. I found a study in Turkey that utilized music therapy in resting periods between blood pressure reading to lower blood pressure of elderly adults over the age of 60 who don't have hearing problems. According to Bell and Okabo, 2017, listening to music, whether a classical, symphony, a jazz ensemble, or a rock and roll band, can not only impact physiological responses, including blood pressure, heart rate, and respiration rate, but also affect psychological indicators such as anxiety, mood, and cognition. Some results of published research on the physiological and psychological effects of music-based interventions suggested that listening to classical music decreases pain, stress, anxiety, blood pressure, heart rate, and/or plasma levels of stress hormones for a long duration after treatment has ended. Results of music-based intervention studies in medicine indicated that slow, quiet instrumental music lowered physiological stress responses, thereby decreasing the secretion of stress hormones, whereas fast, loud, lyrical music heightened stress responses and reduced the reflex sensitivity. Music listening can be an effective nursing intervention for decreasing heart rate, blood pressure, and in some cases, respiration rate in stressful situations. Listening to music may induce changes in physiological reactions, including changes in stress hormone secretions, heart rate, and respiration rate. Similar findings suggest that anxiolytic music reduced physiological stress responses in the cardiovascular system. Other researchers indicated that music can be used as an adjuvant to sedation for the relief of post-operative pain. This was according to Val and Akobo, 2017. They also, according to them, Bal and Okobo 2017, they also found that various types of music have been used successfully alone or paired with other evidence-based treatments as a complementary therapeutic tool to reduce stress and stress-related problems associated with psychiatric disorders, from clinical anxiety to major depression, or to treat the symptoms associated with these illnesses. My plan is to provide music therapy, provide resting periods between blood pressure readings, which will lower blood pressure for elderly adults over the age of 60 years without hearing problems. The Turkish study that I found, according to Burgerud 2013, measured the participants' blood pressure over a 28-day period. This is a type of study that I will conduct in my project. I have already identified 6 willing participants who come to our nurse clinic once a week for blood pressure checks. Since these participants are already scheduled and are willing to come, they readily oblige to take place in my study for my BSN degree. So I will have, this is my due, 6 nurses agreed to participate. Each nurse selected a patient who has a history of elevated blood pressures during an office visit and who has 2 regular 2-week blood pressure checks related to their elevated blood pressure. Each of the 6 patients chosen agreed to participate at the beginning of their visit. The nurse will utilize the American Heart Association 2017 blood pressure technique guidelines, which include the patient sitting upright in a chair, arm raised just below the level of the heart on a flat surface, legs uncrossed, feet flat on the floor, blood pressure cuff touches the bottom of the elbow, and no talking. Each nurse submitted a survey with 3 blood pressure readings, each 2 weeks apart, stating the patient's blood pressure during the first visit without music and 2 subsequent blood pressures with the following solution plan. When taking blood pressures, the nurse will play calming therapeutic music while the nurse is processing the patient, dim the lights, ask the patient to close their eyes and listen to the relaxing music, and step out of the room to eliminate distractions. I have determined the strengths of my project would be that I will be able to help our clinic determine methods that will help lower patients' blood pressure levels. I have found 2 inexpensive interventions, which are music therapy and resting in between blood pressure readings. Since our clinic offers unlimited internet connection and we have a guaranteed population, we have access to music therapy, this should be a successful trial. Some weaknesses for the topic would be that maybe the staff will not cooperate with the data collection or with adhering to the intervention. The equipment may fail, such as the internet, computers, and/or speakers. Some opportunities for the intervention would be the staff participation in a group project, and many patients' blood pressures may be lowered, which would improve their health. Some threats may be that the intervention chosen may offend a patient, and that the intervention may actually increase one's blood pressure rather than lowering it. My study. So this was a chart indicating the 6 patients and their blood pressures over a 28-day period. So patients' blood pressures chart are by systolic value ranging from 125 to 167. The blue bar indicates the first reading without music. The orange and green bars indicate the second and third readings with music. All patients except patient 5 showed steady, consistent improvement in systolic blood pressure. Patient 5's second reading went as high as 167 systolic, and the third reading went down to 139 systolic. My final step is the ACT. Our department manager and our chief medical doctor have decided to designate a relaxation blood pressure room to help our clinic reduce patients' uncontrolled blood pressure rates. They have approved 8 satellite radio stations that can be played during patient care. and they have designated in order to prescribe to their patients who they feel would benefit from this project. According to Zhang and Kim, 2015, recorded music is a non-medicinal nursing interface that is not expensive and not aggressive. Also, it is without any harmful effects on the patient. Therefore, that can be used as a complementary method in lessening the anxiety of patients. Since music is capable of generating positive feelings and lifting people's spirits, these effects can be potentially used in clinical areas to reduce pain and anxiety. They continue to state in an article that the present research manifested that music therapy can bring out positive effects on patients' anxiety and some of their vital signs. Therefore, it is suggested that besides their remedial methods in alleviating pain and anxiety, the hospital authorities and directors profit from non-medicinal treatments such as music therapy, which at the same time are effective for vital signs and without side effects to improve quality of services they are offering to their patients. It is also recommended that authorities and directors of the hospital consider music therapy as an absolutely scientific subject and ask their hospital nurses to make use of music therapy along with other effective, harmless, non-medicinal treatments to best take care of their patients. Thank you, and these are my references.